The Philippine Nurses Association of Nevada now brings you FILIPINARS, news and features about the Filipino-American nursing community and beyond. And now, here's your host, Doris Bauer.
Well, hello, FILIPINARS listeners and followers. This is a special edition or an extra broadcast of FILIPINARS brought to you on Memorial Day. And it's because we have a special guest for this program. This program, as you all know, is brought to you as a public service project by the PNANB, or the Philippine Nurses Association of Nevada, in partnership with PHLB Radio. I am your host, Doris Bauer, current president of the PNANB. Well, how are y'all doing today? I hope that you are staying safe and healthy. And so happy Memorial Day. As you know, Nevada has entered into phase 1 of the reopening of our community during this coronavirus pandemic. Some businesses have been allowed to open following social distancing guidelines, of course. And we rely on the information of the Medical COVID Task Force of our elected leaders to keep us healthy and safe. There is an enormous amount of new information to learn. There are also a lot of things going on in our community, events that we need to commemorate, since celebrating does not seem to be an appropriate word at this time. So today, I have invited one of our elected officials to give us an update and an insight on what's going on in our community and our state. So FILIPINARS is proud to welcome Congressman Stephen Horsford. Welcome, Congressman. Thank you for the program.
Thank you, Doris. It's great to be on. It's great to be with FILIPINARS, and I really appreciate the opportunity. And happy Memorial Day to all those who have paid the ultimate sacrifice, and it's important remembrance, especially to all of their family members who provided love and support throughout their loved ones' time in uniform. You each have served alongside all of them, and like them, you have our utmost respect and gratitude. So thank you.
Thank you. Yes, of course, that's true. Well, as you all know, Congressman Stephen Horsford was elected in November 2018, and he serves and represents the 4th Congressional District of Nevada in the 116th Congress, correct? He's a member of the powerful House Ways and Means Committee, the House Budget Committee, the House Natural Resources Committee. He also serves on the following caucuses: the Gun Violence Prevention Task Force, the Black Youth Suicide and Mental Health Task Force, Congressional Black Caucus, the New Democrats Coalition, you're busy, and of course the Congressional Asian Pacific American Caucus, right?
Correct. Yes,
okay.
I'm an associate member.
Thank
you.
Thank you for all you do. So let's shoot you the first question, Congressman. Okay, the month of May has been designated as Asian Pacific American Heritage Month. Asian Americans are the fastest growing group in Southern Nevada. Do you have a statement regarding the significance of this celebration?
Well, as you said, during the month of May, we honor Asian Pacific American Heritage Month. And even if we can't physically celebrate together, we must stop and recognize all the great contributions of our Asian American, Native American, and Pacific Islander community. We cannot share the history of the United States without mentioning the great contributions of our Asian American and Native Hawaiian and Pacific Islander community. And while we can't celebrate the way we all want to, we need to recognize that they are a very big part of the fabric of our history. From the Chinese workers helping to build the first transcontinental railroad in the 1860s, to Filipino farm workers organizing and leading labor movements in the 1960s, to being on the front lines today of our current COVID-19 pandemic. The NHPIs have helped shape our country's story in so many important ways. So I'm proud to represent a state with a flourishing Asian American community that has become one of our fastest growing populations. And as a representative in one of the most diverse congressional districts and the most diverse Congress in history, as well as an associate member of the Congressional Asian Pacific American Caucus, I am dedicated to promoting, preserving, and protecting the culture and heritage of the community. So this May, I'm excited to help celebrate the unique history and the strength of our nation's diversity and all that the Asian Pacific, Asian, Native Hawaiian, and Pacific Islander community brings.
Yes, thank you. Thank you for that. There's a lot going on in May, and also 2020 is a census year. The 2020 census counts every living person in the United States and in all 5 U.S. territories. Can you talk a little bit about the importance of responding to the census, and how and where are we engaging the citizens of Nevada to participate in responding to the census in this COVID challenging times?
Well, thank you for raising the importance of the census. Every year, about $1 trillion of federal funding gets allocated to our local states and communities based on information that comes from the census every 10 years. And when American households respond to the census, they're helping to make sure that our communities get our fair share of those federal funds. And that's for everything to help support our hospitals, our schools, grants for small businesses, infrastructure projects, and of course, support for students going to college. The census also serves as the basis for fair representation in government. The seat that I hold currently in the House of Representatives came about as a result of the last census in 2010. So my state has received not only another congressional representative, but we also have received more than $6 billion in federal funding every year to the state of Nevada. And that's resources that we desperately need. Now, as our nation gets increasingly diverse, we need to make sure that each person is counted and that each voice is heard so that we can plan to meet the future needs of all citizens. But according to a study, although that the Asian American community is the fastest growing group in the country and right here in Southern Nevada, according to the Census Bureau, Asian Americans were the least familiar with the census compared to other racial groups. So the census now is being provided in English and 59 other languages, including Tagalog, Chinese, Hindi, Japanese, Korean, Laotian, and Thai. And starting in March, since March, I should say, the census has provided phone lines for individuals in their native language where they can complete the census. And we want to encourage every single person to get out there and to be counted.
Yes, yes. I know there's a lot of Asian American groups that are actually engaging, our communities with this. So, and thank you for that. It's really very important. Now, are you legally required to participate in the census? And what happens if you don't answer the census?
So the census is a voluntary but constitutionally mandated requirement. It's something that is mandated to be done every 10 years. It does not matter your background, if your citizenship status, if you are previously incarcerated individual. Every single person who lives in and resides in the United States as of April 1, 2020 is to be counted. And so we have to make sure that people know the importance. What happens if you're not counted is that funding that should come to our community gets allocated to other communities instead. and the representation that we would receive, the count for that gets allocated to other communities as well. So this is about having your representational power as well as getting the allocation of money that we desperately need for our children, for our hospitals and healthcare, obviously, in small business, in workforce development and training, and so many other ways.
There are different state programs. Yes. Yes. Well, thank you very much for that.
And
Okay,
I
so,
do want to commend actually the Asian Community Development Council for all the
Yes.
great work that they've done, the ACDC around the census, the training, the engagement, the outreach. It's that type of authentic community engagement that really does make a difference. And Nevada and Las Vegas and the ACDC is truly leading the way on Asian American community outreach. So I commend them for all that
yes,
great work.
I feel the same way. Thank you. Thank you, Vidalin, for your leadership of the ACDC, actually. Okay. So, Congressman, let's switch to another Nevada current events. You recently announced your support for the Paycheck Guarantee Act. Can you explain what this act is all about?
Mm-hmm. Well, thank you, Doris. As you know, Nevada is among the hardest hit states economically as a result of COVID-19. We have over 30% unemployment now. Nearly 500,000 Nevadans are currently out of work and have filed for unemployment, and more are still applying every single day. So my focus has been on protecting people's paycheck and protecting people's health care. I want to be able to connect and keep people connected to their job and to their wages, and to make sure that we are connecting people to their health care. So the Paycheck Guarantee Act, which I am a co-sponsor of, would literally do just what the bill says. It would guarantee the salary and benefits for workers up to $100,000 annual salary per year. Companies would have to keep all the workers on payroll to be eligible for the full grant. These grants would be calculated based on a company's 2019 quarterly payroll, and then they would be reimbursed directly to the companies via the Treasury, so that there's not this cumbersome process. This is something that would definitely help people stay connected to their jobs. It would keep workers enrolled in their employer-sponsored benefits, including health care. It would encourage employers to rehire recently laid off or furloughed workers. It would cover essential businesses' expenses like rent to help ensure businesses don't shutter completely and that they can reopen when the pandemic ends. So this is a very important provision, and we're working hard to try to get it considered in Congress now.
That's great. That's wonderful. Thank you for doing that. I know a lot of furloughed people. And well, on March 27, 2020, the Coronavirus Aid, Relief, and Economic Security Act was enacted. That's the CARES Act, which was an economic relief package in response to the COVID-19 pandemic. The CARES Act provides economic support at the federal level to the business sector. This is basically the Paycheck Protection Program, which would then expire on June 30 of 2020. We have heard many small business owners have not been afforded the help that they needed. How do you know if this has changed at all?
So thank you. That's a great question. So Congress did, in the first CARES bill, appropriate $459 billion for the Paycheck Protection Program. We added another $310 billion of additional funding to that program, and we set aside a portion to be dispersed directly by community-based lenders, small banks, and credit unions. We also worked to get the Treasury to change their guidance. Initially, small businesses that got a portion of their revenue through gaming revenues, they were not eligible to apply in the first round of funding. So Nevada went from being 43rd out of 50 states in getting the portion of PPP loans to small businesses to now being about 37th.
Wow.
While we still have a lot more work to do,
Yeah.
30,000 Nevada small businesses have received assistance. And I do know that there is still more than $120 billion available. So people should absolutely still contact their local credit union or community bank or local lender and pursue that assistance at this time.
Great. That's good information because, well, you just said 500,000. I think my statistics, the most recent thing that I read was there have been about 300,000 workers in our state that have been furloughed and lost their jobs. I guess that's on a higher.
Yeah, I just got the numbers that are coming out tomorrow.
Yeah.
So we're at 484,000 people who are
484.
unemployed. Yeah.
Wow. That's pretty
The
significant.
biggest, it's the worst unemployment rate of any state in the country, 31%.
Yeah.
And that's why we need to do these relief packages to give support to small businesses, to workers. Unemployment is a safety net. It's not that we want everyone to go on unemployment. That is a safety net program, and that's just geared to help people get their wages replaced. But our ultimate goal is to protect their paycheck. And that is why some of the other bills that we have in place would do just that.
Okay, that's great. So from a healthcare insurance standpoint, this means that these people will not have any benefits when they're furloughed. Or they have to apply for COBRA benefits, which we all know is very expensive. These people are not going to be able to afford this on top of that they don't even have any money to spend. What are we doing in our state to help with this?
So I've actually introduced the bill in Congress called the Worker Health Coverage Protection Act, and it was included in the HEROES bill that we passed on Friday out of the House. This would provide 100% federal financing for COBRA healthcare for up to 15 months for any person who is furloughed or laid off due to COVID-19 related impact. My point is, just as you said, with nearly 500,000 Nevadans who are unemployed, we have nearly 39 million Americans unemployed across the country. The last thing they need is to also lose their health insurance in the middle of a public health crisis. So my bill would ensure that they continue to get 100% of their health care. They do not have to change a doctor. They don't have to change health networks. They don't have to start a new deductible. It keeps everything current while we get through this pandemic. So I'm hoping that now that that has been included in the HEROES Act and that's passed out of the Congress on Friday out of the House, it's now moved to the Senate, that our colleagues in the Senate will take it up and we'll be able to get that enacted into law very soon.
Yeah, well, that's great. That's wonderful. Hoping for that.
Well, and I want to also say this is a measure that's actually supported by the U.S. Chamber of Commerce and the AFL-CIO. This is business and labor saying, let's protect people's health care. So this is not a partisan issue. It's something that we can get done if we all work together. So we are working hard to make that happen.
That's wonderful. Wonderful. That's great news. Okay, so one of the most important aspects of a congressman's job is to develop, implement, and monitor how the laws are being adhered to, right? Do you have any new legislations you're working on? And is Nevada going into another legislative session? You know?
Well, Nevada may have to have a special session that the governor and the Nevada legislators are looking at that due to the major impact of the economy and the loss of revenue on the state and local budgets. What I'm doing at the federal level is to try to get, and we did get included in the HEROES Act that we voted on Friday. It would actually, once enacted, provide up to $8.6 billion in funding to Nevada and local governments. So what does local government and state government fund? Half of the state budget funds education, a third funds health and social services, and another 15% funds public safety. At the county level, obviously they fund UMC, they fund the Southern Nevada Health District. A lot of our frontline workers and the essential workers, and I want to say thank you to those essential workers who have been out on the front lines, the nurses, obviously the doctors, and all of the healthcare professionals who have been providing such important and essential care to everybody, not just those with COVID symptoms, but also our grocery workers, the postal workers, truck drivers, everyone else who has been out on the front line. So what our bill would do is it would help those local and state governments have the money and the resources so that they don't now have to then cut their budgets or lay off more of those essential front workers. That's why we call this the HEROES Act.
The HEROES
The heroes are our nurses, they are our firefighters, they are the caseworkers, they're the people on the front lines every single day keeping us safe, and they truly are our heroes, and we want to fund them so that they are not adversely affected during this pandemic.
That's wonderful. Well, thank you very much for that. Okay, so Governor Sisolak has announced that we are in phase one stage of Nevada in going back to business. Many Nevadans are still cautious in going out to dinner, shopping, or doing other activities. Can you give us an assessment in the way that Nevada has responded to the COVID pandemic? And are you in agreement with this? And how do you envision Nevada's reopening? Maybe look at the challenges that you think will go with this. What's your message, actually?
Well, first, I commend Governor Sisolak and our local officials and state agency heads who worked very, very hard, in part because they made the right decision early to shut down and keep Nevada home, that we did not see the major spikes that we saw in a lot of other places. Las Vegas did not become a hot spot like New York or places in Chicago or New Orleans. We could have, but it was because of that strong leadership early on. Now that we are to the phase where we can start to reopen, the issue is making sure that we have testing, tracing, and tracking and treatment in place to protect our essential workers, to build confidence among our customers as well as the travelers. Las Vegas is a tourism-based economy. People are not going to get on a plane or get in a car or take a train if they do not feel safe to do so. And even once they're tested, we still have to trace and track individuals who may be carriers of the virus. So part of what we did at the federal level, we passed a bill that provided $25 billion of funding. $11 billion of that goes directly to the states and the health agencies so that they can hire more people to do the testing. Obviously, we've been able to set up a lot of these drive-through testing locations throughout our community. That is in part being funded through the federal resources that we passed in Congress.
Okay. Yeah, that's good. I mean, it's really mind-boggling, but I do agree with our leadership, with Governor Sisolak. I think he did the right choice. I think he made the right decisions, and I do personally applaud him for that. So I think we're on the right track because our numbers are showing it.
Yes. But we've got to continue to abide by those CDC recommendations. Even as we start with this phase one opening, we're only going to be able to stay open if people practice those precautions. And so that means wearing a face covering when you're out in public, practicing the 6 feet social distancing, making sure that you wash your hands on a regular basis, and that you are doing everything you can to protect, particularly those who are vulnerable to the virus. It's not so much about always protecting yourself as much as it may be you not being a carrier to someone else.
Right. And I think that's still a challenge. I walk around and I still see a lot of people not wearing masks. So, that's another whole discussion. But anyway, we still keep on, trying to get out that information, remind people, wear your masks,
That's right.
Anyway, okay. So our governor also announced recently that, we are in a fiscal crisis. And I'm sure we here in Nevada are not alone in this. We're looking at budget cuts, and companies will be needing to lay off a certain percentage of their workforce, and more people will need unemployment. How, with the budget cuts, how can we guarantee that our citizens will have access to the necessary programs so they can live, eat, and stay safe? I think you answered this a little bit, but do you have anything to add to what you said?
Well, it's a partnership. The governor and the legislature will have difficult decisions to make. There is estimated budget shortfall of anywhere between $1 to $2 billion over the next fiscal year. So that, I served as the state Senate Majority Leader in 2009 when we faced the last budget crisis, the worst in our state's history. So I do know the state budget. I know it well, and I know the challenges that some of our leaders will face. But the state is our partner. There are things that the federal government can do that states and local governments cannot. That's why I'm working hard to get the HEROES Act passed, which would provide $8.6 billion of funding to the state and local governments so that they can keep those essential services in place. But we've got a lot of work to do in the weeks and months ahead. But I know with the governor and other legislative leaders, we're going to get it done.
Great. Good deal. Okay, we're counting on you now. Okay, so the greater part of our community's employment are the casinos. What do you feel is the responsibility of the casinos at this time with regards to bringing people back to work? I know that some casinos have said that they will test their entire populations for COVID-19 before they can return. Some casinos have said that they will test all the employees and every member of their household. How do you feel about this, and who do you think this burden should be put into? Would this be the employer's burden, or testing, should that be a state burden?
Yeah. Well, part of what the federal government did, again, with the $25 billion that we passed a couple of weeks ago, is to give the resources to the state and the local health agencies. And then they're building up their capacity to work with the private sector, including our large employers, the major casino operators. Mm-hmm. They, along with other large companies, are going to have to test their employees in order to make sure that people feel safe to go to work. They're going to have to put in certain operational controls to make sure that the guests also feel safe. So those are things that are going to be left to the state to implement. But our job is to help them get the resources, and that's been part of what we've done with the $25 billion of funding for testing and tracing, to have those resources in place.
Okay. All right. Now, with the matter of protecting our frontliners by providing them with adequate PPE, where is Nevada in that aspect?
I get frustrated by this because I know that all of our major hospitals, nursing homes, and healthcare facilities, they have to report to the governor and to the Nevada National Guard that they do have adequate PPE. Meanwhile, I will hear directly from nurses and healthcare providers, and they'll tell me, well, yeah, but I'm only issued one per shift. And I'm seeing multiple people, some of whom have COVID, and even someone who worked in the ICU who was not provided adequate PPE, even though she was going in and out of an ICU unit. So I think that there needs to be greater accountability on the hospitals and the nursing homes. We have fought very hard to get more personal protective equipment to the actual workers, the healthcare workers. They're the ones who need to protect their lives. They're literally putting their lives on the line in order to provide that care. So I bring this issue up often, both on my congressional committees as well as at the state level, to make sure that we are raising the concerns that so many healthcare workers have raised to us. So we know it's an issue, and we'll keep fighting until they get the protection they need.
Yeah, well, I know that from our organization standpoint, and in cooperation with the Filipino community leaders, we have created the Bainihan Project, which part of that is the masks and shields. You know, we are actually making homemade masks and homemade shields, and these we help to dole it out to the frontline workers in the hospitals, those who are not actually working in the ICU, but those, you know, who will at some point come in contact with, you know, some COVID positive or people that have been exposed. So we're trying to do our part as well. But the COVID cases are now seen in nursing homes and in traditional, transitional care facilities. And these places do not have adequate PPEs. Most of them rely on the donations of community groups and businesses. Is there a plan to provide more accessibility to these places?
Yes, actually, every nursing home is provided through it's called Center for Medicare, CMS. They are regulated by the federal government and the state government because they receive Medicare funding. So one of the first things that was done was that every nursing home had to raise their standards, do additional inspections, ensure that PPE was being provided to the frontline workers. And we are doing congressional oversight because we know that the highest rate of people affected by COVID and the deaths disproportionately are from people living in nursing homes. So it's a huge vulnerable population, and we cannot allow for those standards to not be adhered to.
Yeah, and we actually donated some masks over to a psych facility who recently had another COVID patient come into their patient population. And one of the nurses had told me that they are actually made to purchase their surgical masks on their own. So to me, that was heartbreaking. And so, we've been we gave them some masks and whatnot. So I'm hoping that this is going to improve at some point, which I'm hoping that with your, suggestion and with your work on this, that would be great.
Well, Angeline is a great team member. We will follow up on that issue and any others that you raise with us. And those are the types of issues that, we can try to bring attention to in our role. So thank you for raising that.
Okay. Yeah, I'll talk to Angie. All right. Okay. Well, all right. That 2020 has been designated by the World Health Organization as the Year of the Nurse and the Year of the Midwife. And we just celebrated National Nurses Week. I know that we could not celebrate, properly this year. And you did mention the nurses already, but do you have any special message to the nurses?
Well, I want to say thank you to our nurses. Our healthcare workers who are on the front lines of this pandemic, who are working tirelessly to treat our sick neighbors and to prevent the spread of this virus. I want to thank them for the sacrifice that they make every single day and the stories that have been shared with us. It's your commitment to the livelihood of others and the dedication to our communities that help to continue to push us forward. We owe it to our nurses to follow the CDC guidelines, to stay home, to prevent large gatherings, and to take precautionary measures when leaving the house. It's not fair to those who are working so hard to try to keep this virus under control to then go out and do the very thing that causes the spikes. So to our nurses, doctors, physicians, lab techs, first responders, and all of those who are working to keep families healthy and safe during this pandemic, thank you for choosing to be in this profession to help fight this battle, even if it means putting yourself at risk. You truly are our heroes, and you will never be forgotten.
Thank you. Thank you for that. I'm not a frontliner anymore, but I do think that the frontliners are the heart and soul of the cure for this pandemic. So thanks for that, Congressman. Now we're ending. And so do you have any other messages to the public?
Well, first, I just want to thank FILIPINARS for having me. And Doris, thank you for this interview. It's been great to be on your show and to just remind people that, I know these are difficult times, but we are going to get through this together. We've had challenging times before as a community, as a state, as a country, and as a world. Clearly, this is not like anything I've seen in my lifetime. But one of the things that I have said is that, this pandemic really has exposed a number of the issues that many of us have talked about for a long time. That includes the health disparities that exist, the income inequalities, and a lot of the injustices that are out there. The Asian American community has been disproportionately affected by this pandemic, as I was saying earlier, and we need to make sure that you know that you matter and that we get you the services and the support that you need as a community. So I want to thank you for having me on. This is a part of Asian Pacific American Heritage Month.
Yes.
And the contributions of the Asian American, Native, Hawaii, and Pacific Islander community are significant. So share this month, be proud in your culture. Thank you for allowing me to participate with you tonight, and I look forward to coming back on very soon.
Of course. Well, Congressman Horsford, thank you so much for agreeing to come to our podcast to enlighten us on some of the Nevada current events here. We are truly honored and privileged. I know you're busy, and thank you for your time. You have given us some great information, and it's inspiring what you are doing. And I would also want to thank your staff, especially Angeline. Hi, Angie, for making this happen. And I'll be in touch.
Thank you. Again, Angeline does a great job.
Happy Memorial Day to you and to all. And to our listeners, we are not out of this COVID crisis yet, but we are on the right track. And remember to adhere to our staying at home guidelines, your social distancing guidelines, and paying attention to hand hygiene, wearing facial coverings. Please stay safe and stay healthy. Happy Memorial Day. This is Doris Bauer, your FILIPINARS host, signing off for now.
The Philippine Nurses Association of Nevada has just brought you FILIPINARS, news and features about the Filipino American nursing community and beyond. Fridays, 7 p.m. on PHLV Radio.